I'm going to share the screen so that we can have a look at the scenario one more time. So our next task is Molluscum Contagiosum. Our next task is Molluscum Contagiosum. In this particular case, let's look at the background information. You're an FY2 in a GP surgery. It's a 30-year-old lady who has made a phone call appointment to talk to you. Your task is to talk to the patient and address the concerns. So her child, Alicia, aged 5, has developed a rash in the last 1 week. The rash is itchy and is on the chest and on the armpit. You have heard that other children in the school have got a chicken pox. You are 28 weeks pregnant and you are concerned about it. So the mother is concerned because she's 28 weeks pregnant, concerned that the rash may affect the unborn baby. And the other children at school, they have got chicken pox. That's what she has heard. The child has got a rash, few spots on the chest and in the armpit. She has got the questions. Will the rash affect the unborn baby? Is it chicken pox? Approach to the task. Grips as usual. Then you're going to take the history of the presenting complaint. In this particular case, you should be able to ask the following questions. When did the rash appear? Where does the child have a rash now? Remember, you need to look at this separate or different video that deals with the rashes. Is the rash itchy? What is the color of the rash? Okay, where did the rash start from? And how many spots or how many rashes have you noticed? How would you describe the rash? Or what does the rash look like? Then consider the differential diagnosis of Molluscum Contagiosum, acne vulgaris, other infections, remembering to cover the fever, the cough, the running nose, urticaria, okay, thinking about the allergy, of course. Then you have to ask the typical symptoms of Molluscum Contagiosum, the typical features which may include usually 1 to 30 individual lesions. Lesions are smooth-surfaced, dome-shaped, okay? Dome-shaped. And they are fresh-colored or pearly white papules with the central umbilication. Just a second. Okay, guys, we continue now. So what did we say? That usually it's 1 to 30 individual lesions. The lesions are usually smooth-surfaced, dome-shaped, fresh-colored or pearly white papules with the central umbilication. Lesions are usually 2 to 5 millimeters in diameter. So you need to know roughly the size. Any part of the body can be affected, but commonly it affects the trunk and the flexures, the foldings. Yeah, good. We're going to look at the picture shortly. So I'm going to go forward to show you. So here is a picture in here for us in a description. So you can see in here, they are round, they are smooth, and dome-shaped on top. And you see the umbilication, the depression on top. This is typical of Molluscum Contagiosum. Okay, so I'm going to go back. Yeah, we can see there are the lesions in here, smooth, dome-shaped with the central umbilication. That's how they look like. So let's go back now. Yeah, smooth-surfaced, dome-shaped, with the central umbilication. Risk factors. Well, close contact with infected person, immunocompromised people. So, which means as part of our history, we should be asking if they have been in contact with anybody with similar lesions. Now, remember the mother said there's chicken pox at school. You don't know whether it's a chicken pox, okay, or actually it is Molluscum Contagiosum. So complete the other history. The PMAF tells the eyes, the effects of the symptoms, and the travel history is important because you have to exclude the other infections. The pediatric history, birth, immunization, red book or development, eating and drinking, ask about problems in pregnancy and delivery, of course. Examinations, you need an inspection of the lesion, and you have to check observations to see whether there is a fever or not. In this particular case, as we saw, this is the Molluscum Contagiosum. That's how it looks like. You know, it's a smooth, it's a round, it's a dome shaped on top, and there's umbilication, that's depression on top of it. In this case, we've got 4 lesions, and we said it could be anywhere between 1 and 30 lesions, usually 2 to 5 millimeters. Diagnosis, explain. Now, remember, in this particular case, it was a telephone call, so therefore you're going to find the picture in the station. Explain that Molluscum contagiosum is a viral infection caused by a virus, Molluscum contagiosum virus. It reassure it is a self-limiting condition. Treatment is usually not needed. Spontaneous resolution is expected within 18 months on its own. There are certain situations that you can treat. Usually that is genital, contagiosum, Molluscum contagiosum, sexually transmitted or sexually related. That's when usually you would treat. And if you are going to treat, there are different creams that can be used. But in this particular case, this particular child, we do not have to treat. Give general advice. The lesions are contagious and they spread by direct contact. So they should avoid sharing towels, clothing, or beddings. Exclusion from school is not necessary. So if there is a problem at the nursery or the preschool, they don't have to stop the child from going to school. Child can continue going to school. Remember, it takes time to resolve, up to 18 months. Offer the leaflet about Molluscum contagiosum. If the child is itching a lot, if there's a lot of itching, then we can consider, antihistamine. In this particular case, the child wasn't itching a lot, so there wasn't a need of giving antihistamine. But it's case by case, you need to ask. Thank you. Now, the question is, will it affect my unborn child? Molluscum contagiosum generally or usually does not affect babies from the infected mothers. So even if she is infected, usually Molluscum contagiosum does not affect the unborn child. Okay, but it's something that can be monitored when the baby is born, just to make sure everything is okay. Thank you. That was a Genius 2023.